Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. This episode is sponsored by Surgical Information Systems, providing cutting-edge information solutions for surgery providers and ambulatory healthcare strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 139 of the ASC Podcast with John Goehle for September 27th, 2021, recording live from the Hilton Polaris in Columbus, Ohio, and the Ohio Association of Ambulatory Surgery Centers annual conference. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle, and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies and recognized as one of the nation's leading experts in the ambulatory surgery industry. Mr. Goehle is the author of over 10 books on the ASC industry and a frequent industry speaker on regulatory accreditation and finance issues. And our special guests today are Judie D'Ambrosio, Director of Educational Services and Senior Consultant at Ambulatory Healthcare Strategies, and Mike D'Ambrosio, Senior Consultant also with Ambulatory Healthcare Strategies.
Welcome. First of all, the listeners probably noticed that you had the same last name. So this is so weird. We're here in Ohio for the annual conference, and we decided to send two couples down because we were too cheap to get more than two hotel rooms. So that was
cost savings.
I totally understand that. Yeah.
Mike, I want to welcome you on board. Now, you've been a guest on the podcast a number of times because you've been with Judie, obviously, for a long time. And
a couple years.
And a little over 25. Yeah.
A little over 25.
And sometimes, often you come to the retreats with us. So, but now you are officially an employee of Ambulatory Healthcare Strategies and officially retired from J&J, correct?
Correct. Thanks, John. First of all, looking forward to learning this industry a little more, coming from medical device, over 25 years of medical device experience with J&J, with ortho clinical diagnostics. The regulatory part of this industry is extremely intensive, much more rapidly changing. So I'm looking forward to getting down and dirty with the regs.
That's a good way of putting it, down and dirty. Emphasis on dirty. It's interesting. Of course, we've been talking here at the conference, and this is our first time in almost 2 years. The last conference we did together, so we did a conference out in Texas, remember, for the Nursing Leadership Conference. I think it was in February of 2020, just before the lockdown. I know you're looking at me like, did we really? It does. It seems so long ago. And that was the last live conference we did. We haven't done one of the state association meetings in 2 years, live. So it's great. So I was in Texas last week. We're in Ohio right now, and all four of us are heading out to New York. We're going to be in force in New York. I think we have 8 people.
Oh, wow, yeah.
But what's important to kind of note here is that Ambulatory Healthcare Strategies has doubled in size during the pandemic. Of course, we're a family-owned, family-run business, even though, Judie and Mike, you're not officially members of our family. It's like we've been friends for so long,
predating
but I got
our
here
time.
First. That's right.
But I got here first. So
employee number one and co-host number one.
You're right.
So many people are probably listening and saying, I recognize that voice if they were crazy enough. They go back and listen to episode 1 through whatever it was.
They said, Sue's a captive audience. She's always there. So I'll just have her talk.
But it is great to be here. It's great to be. We have this kind of mini studio, which is actually the storeroom at the Ohio conference. So in the background, you might actually hear the light there. So we're recording this while one of the sessions is going on, and Mike tried to turn the volume down as low as it would go, but it might be hearing that in the background. We might be interrupted here, but actually, I'm really grateful for the Ohio Association for giving us this one room. It's very nice of them. So let me just talk a little bit about what's been happening with conferences lately, because I was in Texas last week. We're going to do a special episode from Texas. I'm going to apologize right up front. The recording quality is very poor. We weren't able to send the entire studio down there, so we used one of those handheld mics that goes that attaches to my iPhone, which doesn't work quite as well. But we had a great conference. I'm going to talk about that in a few minutes. Some of the things that came out of it, and then here we're in Ohio for another 2-day conference. We're recording actually during the day that the part of the conference where we're talking about infection control. It's interesting. We walked around. All of you walked around and saw all the vendors. Any observations about some of the vendors or anything that you kind of saw as you're walking around? I know, Sue, you're always looking for things to take home for the kids. But
Yes.
Mike and I found one interesting around the corner from us. And it's a vendor I've never seen before. And I've been to several. I mean, not lately, certainly, but I've been to several of these.
Yeah.
And do you remember I apologize because I don't remember what they were called, but their whole thing was PPE. They're just.
Okay.
They had a great display set up. Obviously the importance of PPE in this pandemic era is paramount. And they had an array of products for ambulatory surgical as well as other.
The disinfecting wipes and all that. I mean, and I'm sure, it's amazing the kind of industries that came into being because of the pandemic.
Yep.
That.
I also, having not been to conventions in quite a while, but in conferences, but I found it interesting. There seemed to have been a little bit of excitement about people being live again. There seemed to be a little bit, behind the mask smiles. People actually meeting one-on-one and interacting.
Yeah, I think so.
Yeah, we're actually just talking about it as we've been meeting people here, that the virtual is fine. And, and I think anybody that's listened to our virtual conferences know we do things very differently than everybody else. And we're going to continue doing that because the virtual conferences, one of the challenges about live conference, not everybody can go. And when we look at the attendance in Texas and here in Ohio, I have talked to the membership people, and they've said that the attendance is way down. Down, not way down necessarily. But it's not just that people, actually, it doesn't seem like it's that people are hesitant to come out because of COVID. It's just they're so darn busy right now, and staffing is really low. And I think that that's what's really starting to cause some of the problems that people just can't get away for 2 days to do this sort of thing.
That's true. I didn't think about it that way.
Yeah.
Isn't there one of the sessions tomorrow is how to deal with all of the staffing issues and how that may get worse before it gets better?
Yeah, absolutely. So let's talk about almost an elephant in the room right now. The whole issue of vaccine mandates, of course, has come up since the last episode. And we need to go on record. As a company, we feel very strongly about vaccines. I'm not going to say we feel strongly about the vaccine mandate, but we feel very strongly that the vaccine is an incredible thing. I encourage everybody to get, vaccinated. I understand the reasons for that, but my concern right now as we watch what's going on at the federal and state level is what the ramifications are going to be for businesses long term. Mm-hmm. I've always felt, and again, now this is going to sound political, I've always felt that you can get a lot further by encouraging people with good information to get vaccinated instead of like saying you have to do it and therefore, forcing them to do it, because, there's always going to be that population. I think we have children that are like this, that, resist growing up. Now, all of our children, of course, work for us now, so they get in. They're the ones that are saying we need a mandate. But I think that the more you push somebody and tell them they have to do it or they're going to be penalized, the more they're going to fight back. Mm-hmm. Whereas if we can give them great evidence, we have one of our nurse managers, for example, wants to become pregnant, and she's been resistant to the vaccination for a while, and then there was some information out there that indicated that there might be a problem for people that want to become pregnant. And Jenna did a fantastic job of researching this information. She went way above and beyond what you need to do in order to, to work with somebody on it, because it's not really our job to convince people to get vaccinated. And she provided all this information, and the woman decided to get vaccinated after that. That's the way this should be done.
I do think there's a lot of good information out there. I will say. I think people really.
You do have to look for it, though, right? So, I mean, you do a lot. I mean, as the chief researcher, you spend a lot of time, looking into it. But it's not always easy to find. I mean, you're frustrated. We have these, we have no ongoing conversations about, our family anymore. It's really about everything related to grandchildren maybe, but everything related to vaccinations and all the stuff. That's
to get exact data and to know exactly how much at risk, how many people are getting sick after they've been vaccinated, how serious it is. Those statistics I think can be hard to come by, but I think the evidence is pretty clear that it's beneficial to get vaccinated.
And
I don't.
The story
I don't think
you tell is actually more of a nice representative of Jenna.
Yeah.
How she took time out of her personal life because when you're one of our clients, you're not really a client. You're someone we actually care for personally. So we become friends with our clients where it's important that they trust us. And sometimes we may be the only voice of reason they have, because there's so much misinformation.
Well, and to take that step further, that's the problem with the public dialogue. Everything is so political, and nobody trusts politicians. We know that. So why are the politicians out there fighting? I want to see the doctors out there.
But that's on the doctor. I mean, the politicians, I think. And I know this is a disagreement we sometimes have, but because I think everybody should be out there saying what they believe. So if, the politicians are saying it, the doctors can still say it, and I think some do.
Yeah. I think their voices are being drowned out, though.
I think you point out, I think one of the best ways people are going to be persuaded is through people they trust.
Yeah.
And I think getting the message out through a trusted source is really the key.
Yeah.
There was something I did through that I started taking this course. I forget what but it was
New York State. Yeah.
It was through New York State and through Cornell that gave information about the vaccinations, about the pandemic, all of this kind of thing. It was directed at lay people so that you could kind of be that voice of reason in your neighborhood. I think that was a really good effort because it was meant to be for lay people that could, as they're talking to their neighbors, they could counteract some of this false information that was out there.
But I think the interesting thing about the vaccination mandate and the concern that I have isn't even so much for those of us in healthcare, because I think we're all accepting that really hopefully everybody is starting to accept the fact that everybody needs to get vaccinated in healthcare. But if we do have a national mandate for all companies, I know one of the proposals out there is anybody that employs over 100 people will have to require vaccinations for all their employees. My concern with that is the downstream effect. When we were in Texas, we were talking about this a little bit, but, we have a lot of suppliers, big suppliers. One of the things that was mentioned in Texas by one of the distributors is that the warehouses are having a hard time finding employees before the mandate. People don't want to necessarily go back to work. A lot of people are retiring that are older that work in this place. And somebody pointed out, who wants to work in a warehouse lifting heavy stuff, moving around with all this when you can be flipping burgers, for the same dollar amount? I personally probably would be preferred to work in a warehouse, but not everybody has that attitude. And I think, so they're finding a hard time finding employees, delivery drivers, truck drivers, people that are involved in the delivery, apparently are suffering significant. We've heard about this with truck drivers. And I think one of the other issues with truck drivers
too.
And bus drivers, right. There's been a huge decrease in the number of people that are available, which is causing supply chain. One of the things that was mentioned in Texas is, if your delivery service, in other words, your medical products are being delivered by FedEx or any of the major overnight, as you go into the fourth quarter with Christmas, because it's going to be a pretty successful Christmas, they're predicting, because there's lots of money out there, through the pandemic and all of the, people that are getting paid for unemployment, et cetera. They believe Christmas is going to be actually a pretty good Christmas this year. All of those delivery companies are going to be delivering, Amazon, FedEx, the U.S. Postal Service. They're going to be delivering that, which is going to put real delays. You'll still get the deliveries, but there'll be real delays in this. So be careful and, keep an eye out for truck deliveries. Like the major distributors tend to have their own trucking companies, but expect, I got to tell you, I think a lot of places are relying on Amazon now for delivery. So expect some, challenges there on the supply side. But I think I just want to talk talk a little bit about that. Just think about some of the suppliers that we have that might be affected by a national mandate. We know during the pandemic we had a lot of problems with construction. We had a lot of problems with, repairs, getting people to do equipment, maintenance, things like that. You worked on the medical device side, of course. Just getting anybody. I'm sorry. I realize that even though I'm pointing to Mike, nobody can see me say that. So, Mike, were you seeing at J&J any issues on the supply chain? Of course, you laughed about the time that,
Certainly, we were seeing delays coming with certain key components for manufacturing. Delays, we were seeing delays in bottles. Vaccine was obviously a priority. So we were seeing particular specialty glass for some of our calibrators and controls that were delayed. Production schedules were actually changed, especially in the first and second quarter of this year, just because of that inability to get key raw materials, shortages, and diverting to other sources. So
that was a big comment that was made also in Texas, is that raw materials are going to be in short supply as we move on because of the difficulty in transporting it, especially if it's coming from other countries that are coming by boat. I guess we're having issues at the ports.
But John, you bring up a good point. Between COVID and lack of skilled labor to unload the container ships, there's also just a huge backlog, and that just creates a ripple effect with delivery, especially from Asia.
So now these COVID mandates are just going to add to our ripple.
That's right.
Which is going to make it.
And I think the takeaway here is just be prepared for this. Be prepared, and then if we're already finding in New York, the governor of New York has already said that she's preparing to bring in the National Guard.
I saw that.
And nurses from out of state in order to take care of what they expect to be up to 20% shortage of employees.
But now that we have mandates on the federal level, will there be?
I know. I doubt
will there be other states that have healthcare people to spare?
Well, let's talk about that for a second, because some of the states, like New York, their mandate actually doesn't include a religious exemption. Now, that's been stayed for now, at least until mid-October. Right. So a judge has basically said you have to accept these things until we settle this issue in mid-October. But that type of the religious exemption, which would open up the ability for a bunch of more people to exempt out of that requirement, that is in existence on the national level. Or if the proposal would include a religious exemption up there. But that's going to be interesting to see how people, who have a choice, who can move between states. We know in New York, for example, people in the tri-state area, they'll just go across the border and
work in Connecticut, or work in Jersey, or where people where we're from in Rochester. It's not like you're going to drive almost 2.5 hours.
Right.
We can't get into Canada anyway, so you can't get a job there. There are people that have options.
So I think we just have to start developing some contingency plans as to what you're going to do. If you're, obviously, if your clinical people are reduced, we might have to cut down a number of rooms. But I've been preaching for years. Sounds funny for a minister to talk about preaching, but yes, I've been preaching for years the importance of keeping your inventory levels down. And now we learn that this is not the environment. Open up another storage room. Turn the administrator's office, half the administrator's office, into a storeroom, and
the just-in-time stuff that works very well from a financial standpoint is probably not where you want to work with
right now.
Right now, it's going to be okay. Hoard what you have,
especially PPE too.
Especially PPE.
Your inability to start up. I did want to bring something up. We keep having to say this, but it is still happening, Judie. I know you've had a couple issues, even with some of your clients, is that people are not wearing N95s properly again, or still. And I know, Mike, as you are becoming or will become, and already partially our expert on OSHA, but
in order to wear an N95, they have to be properly fitted and tested.
Right.
And then
you can't just throw them on.
And use that brand. I think that's where I had a problem. Oh, but they've been fit tested. Oh, we don't use that one anymore because the supply, we can't get that supply, so we're using this one. Yeah. Okay, that's great that you got some. Now they have to be fit tested for this one. And you have to keep that documentation because if somebody asks, if you don't have it documented, it didn't happen.
Well, but
it's not terribly difficult to do. It's just that you have to.
It's irritating and time consuming, and I understand that.
Yeah, actually, Sue, you've fit tested like 2 people already in the company?
One.
One. Oh, I'm sorry.
Just you. Pretty much just
a little bit of exaggeration there. So we have one person.
But it was very easy.
Yeah, it was. Yeah.
So anybody that's had it done is,
I used to have it done in my hospital days.
To Mike, to your point, what we're actually finding the biggest violation right now isn't even so much the fit testing, though we are getting people that are forgetting that they have to do it annually, but not changing the mask after
between patients. How does that happen?
It's interesting you should bring that up because somebody, is this new that now we have to change it? No, I mean the requirement has always been there that if you are in the procedure room, in an operating room, it doesn't matter what mask you've got on, you've got to change it.
Although wasn't there a time at the beginning of COVID when things were bad and we were scrambling because we didn't know what to do, that there was an exemption to reuse them?
And there were people working on re-sterilization of N95s, et cetera, during
that's over.
Acute shortage.
But truthfully, during the pandemic, you still had to change your mask. I mean, even more so during the pandemic because, the droplets on it, all of that. So, but it was, you could put a mask over your N95 or your KN95. Now we're really kind of beyond that whole thing. But I just wanted to get that out there.
Maybe that's where the confusion came from.
Or people didn't think about it. If it's just a little surgical mask, you take it off, you throw it out. They don't cost much of anything. So maybe nobody really thought about it. And now they're thinking, wait a minute, I don't want to spend all that money.
Yeah, that's a good point.
And that's it. It's a significant cost increase if you're going to 95s and versus.
Well, and do remember too that there is no regulatory requirement that you have to wear an N95. There's no regulatory requirement that you have to wear anything other than a surgical mask, and there's really not even a requirement as to a specific type of mask. Most of the times, that is a policy issue that you have adopted in your organization. So,
but for those of us in New York State that just enacted the HERO Act, if your respiratory prevention policy now that you enacted because of the HERO Act says that you're going to use them in these areas, well, now there is a regulatory reason that you have to use them.
Well, but again, you're following your own policy, so be careful with your policy. Some people have implemented a requirement that you do N95s without realizing that they were going to be almost instantly, very soon doing a requirement. But you have to, this is an individual decision. You work with your doctors to decide whether an N95 is appropriate or necessary, but make sure you follow your policy, because that's what we as surveyors are going to do when we come in. We're going to be looking to make sure you follow policy. We're not going to say that you have to wear an N95, but if you say that you're going to wear an N95, you got to do it. You got to do it right.
Yeah.
It's almost like not back yourself into a corner,
right?
If not needed.
Yeah.
I still want to continue talking a little bit about the supply chain issues, because we've been talking about making sure that the inventory levels stay high, so I'm kind of a minor prepper, not an end of the world prepper, but somebody that, especially being in Texas, because there was a lot of conversation in Texas about what happened with the major storms, the loss of power, et cetera. And so I've been listening to some of the prepper stuff, about what you do for power, what you should be stocking up on in your house. And I think, just listening to the people there and the types of challenges that they had made me start thinking again about prepping from a surgery center standpoint and stocking up on various things to be ready for it. So again, we talked about, making sure we have plenty of PPE. We talked about, raw materials going down. The other part of this, and we're actually going to do an interview later, with one of the attendees here about being prepared for even an emergency like losing your coding person. I mean, as silly as that sounds, like, I have to have an emergency procedure. Yeah, I mean, because think about, any one of your employees, being out probably could, potentially cause a problem depending upon the ability to replace them. But I think you need to think ahead, what types of supplies might be in short supply in the future. Think about what would happen if all of your gowns come from, China. And that's a PPE we've already talked about. But, what would happen if all of your packs are coming from one particular location, you can't get it to you? Mm-hmm. So have backup plans. Not only should you have a plan as to, to build up in the supplies, but a plan as to what you do if you can't get a hold of something. Interestingly, during the pandemic, I have not seen any major problems with drugs. And we've had some drugs that are on back order, et cetera, and that are short supply, but not to the extent that I expected. However, I do expect that's going to be an ongoing problem. So keep an eye on those supplies and have some type of a backup plan for it. again, to continue to talk a little bit about Texas and some of the things. I attended one session on emergency preparedness. So a couple of they had this panel discussion where a bunch of administrators talked about their individual personal experience with what happened during the rolling blackouts. And a couple of interesting things came up. And Mike, you probably appreciate this one. We were talking about generators. And what was happening in Texas is that the power would go off, come back on, go off, come back on again. And the problem with that is every time it happened, all of that equipment that you have, especially computer equipment. So some people, lost servers, lost computers, not lost, but you know what I mean, is that they broke down because they were no longer able to take those surges. And somebody pointed out, this was important, is that they literally turned their generator off because they knew that with the rolling blackouts and the fact that the power was going up and down, they were not open.
Off, right?
Yeah, they were not open, so they didn't need that backup power. And the stress that it was putting on the generator by constantly coming on, going off, and things like that was not very good for it. So something to think about. If you're going to be out of business and because of not being able to get stable power to the place, consider turning your generator off so you're not putting it through that stress.
Think through because surges are
pretty damaging.
Will damage.
Yeah, and another thing that happened in Texas too is many of the suppliers, we know that this is something you got to be cognizant of. They could not get diesel fuel right away, so they were running low on diesel fuel. And even those that thought that they had an arrangement with you might have an arrangement to have diesel fuel delivered, but not always were the diesel fuel delivery companies able to actually meet up
your
with
supplier has a supplier of their own.
That's right.
So you're kind of far down that totem pole.
And they're going to prioritize.
Oh,
hospitals.
Tell me about it.
Right.
And another ththing that was discussed is that while some organizations were prioritized during the power problems in Texas, you want to prioritize those organizations that have ventilators, for example. And usually surgery centers are not on that list. So the state association down there was talking about getting together with, emergency preparedness leaders and saying, can you put surgery centers on that list so that they can continue doing the things that we need to do? I'm very passionate about this, and I know all of us in the company are, that this whole terminology during the pandemic of elective versus non-elective surgery, I don't believe there is such a thing.
Either do I.
Yeah.
I didn't then either.
Yeah. And I'm hoping that people are starting to understand that if it's truly elective, that means that, it's like a plastic surgery case, in my view.
I need a nose job. Okay.
Yeah, that's right.
But that's pretty much all I can think of.
Yeah. And we already,
tests and all of that,
we're already seeing that. We've seen that in some of our New York City
we know
facilities.
that personally. Mike's still waiting for surgery that he had scheduled prior to the pandemic that we still haven't had.
Is that the brain replacement?
Yeah, that was exactly it. His lobotomy.
That would be the lobotomy that she has scheduled for me.
Stop. That bothered me then. I understood it.
Yeah.
Like I got it.
Yeah,
but then it got to a point where you kept hearing from people that said, well, I can't have that. I can't have my kidney stone removed, so I'm going to live in this pain because they consider that elective. And I'm like, how?
Yeah.
How is anything elective that isn't, eyebrow tattoos or a nose job?
Now, one of the more interesting conversations is somebody mentioned that they lost a lot of medical records during the pandemic. This will probably be interesting to you, Judie, since you're finishing up a master's degree in medical record. What is your degree going to officially
When I
be
come out, I will be a registered health information administrator, which means I can be a medical record consultant.
Right.
So I can't wait to hear what you're going to say.
Yeah, you're going to find this interesting. So I thought we had already gotten people to understand that you probably shouldn't be storing medical records in the basement on the bottom shelf.
Haven't we told everybody that by now? Make me crazy. And that was crazy before I ever started school. That still made me crazy.
Yeah. So, please. And I even, I did a survey recently where I walked in the, sprinklered room. There was no protection in case the sprinklers went off for the medical records. So this one center talked about how they, had to, let every single one of the medical records dry, and then they had to try to figure out how to separate it out. And
oh my God.
A lot of damage. Had to throw a lot of, it was a nightmare. So, just think constantly of, what would happen if you were, flooded. I mean, there's no longer can we say that, the chance of that happening to me is, next to nothing.
Well, then we had talked about the one center that we worked with for a little while that had a fire, and the fire didn't do so much damage, but the sprinklers
did it. Yeah.
That's what usually happens. The sprinklers, will.
Well,
Yeah,
and
it's a lot of
that place also had extensive mold. That's what I've been telling the people in Texas is that, you're not through it yet. You might have some problems longer term with mold and mildew in your center. So after the water's been dried up, you might still have other issues. The last thing that came out of Texas, which I thought was interesting, and this is very personal to all of us, or at least in our company, an interesting conversation about outsourcing. We know as a company, of course, during the pandemic, our company, as we've already mentioned, doubled in size. And one of the reasons for that is people literally have decided, I'm going to outsource my regulatory compliance oversight because I just can't do it. It could be various reasons. First of all, there's just so much coming down the pike and I can't keep on top of it. Second reason is I'm too busy doing other things. I've got to worry about, fit testing. I got to worry about covering the operating
how many
rooms,
of our
hiring new
administrators
people.
or our nurse managers are actually floor nurses now?
Yeah.
Like I have 2 hours on Fridays where I can do administrative because I'm a staff nurse. And I think with the staffing, that's going to also get worse before it gets better.
What they were talking about in Texas, we talk about regulatory outsourcing, of course, but there's all these other types of outsourcing. If you can't get an accountant anymore because they've retired or decided, outsourcing your accounting. And one of the things that we have talked about a lot in our company, that, the beauty of outsourcing regulatory compliance is nurse manager leaves. Judie's just working on Sundays. You know what I mean? Is that's
I'll sleep when I'm dead.
That's right. No, I think that's the beauty of outsourcing is that hopefully you're hiring a company that has more than one employee, so they can cover you during that time.
And we've had to do that.
Yeah. Well, and management companies are hiring us now because management company might only have 3 people. In their oversight, we got 17.
Can you believe that you just said that out loud in a sentence?
As employee number 1.
Remember when it was just you and I?
Yeah.
There were 17 of us. It's amazing.
Yeah. Makes for very interesting retreats. So
way more fun.
Definitely think about outsourcing different aspects in your organization.
Yeah, not just the things we do, but you're right. There's all sorts of things that you can get help with.
Well, and to that point, you're gonna be amazed, Mike, at the segue, because one of the things that has been outsourced a lot recently is things like fire drills. Having people come in and do fire drills, disaster drills, and things like that. That is a service that we are offering now as part of our retainers, our general retainers, depending upon the tier that you get. Is we do offer doing the drills for you coming in on a quarterly basis. So, Mike, you had your first experience with a drill.
I
recently.
did.
Talk a little bit about that.
Yeah, what drills did you do?
I got to accompany Alex, who is doing some training. Obviously,
the old guy?
Setups from the old guy that is learning new tricks. So I found it very well organized.
Yeah.
He had a script along with the policies at the particular center. Those were reviewed. Then the drill was exercised. Fire drill was pulled. The staff executed it in an orderly fashion. Saw a few things that Alex jotted down as opportunities, but they was able to be performed in a short 45-minute window, and we then went on to a code blue code again. One's required quarterly, and just had an outstanding nurse manager that kind of led that and was able to elicit information from her staff. I thought very key questions, and again performed in a 45-minute time frame, and then did the
MH. You didn't know.
Thanks, MH, which was a brand new terminology for myself.
Molecular hyperthermia.
But again, the nurse manager followed the policy, had that scenario set up, and again, the 3 exercises. My first experience with it, I went in an hour and a half, 2 hours, and I thought a couple observations were made, but really did a great job walking through it. So,
and I hate to give Alex credit for anything.
Yeah.
But I will say, when it comes to drills, because he's where we started with this, and he has scenarios down. I mean, he has
so many.
He has scenarios for things that nobody else would think of.
That's right. World War III.
He has got a heck of a library. He really has done his research on what needs to be done, and we're now able as a company to offer all sorts of things that you need. I'm glad he got to see it.
Yeah.
It was.
And the point about taking notes is so important because you want to show what you've learned from it. You don't want to have it just go so smoothly and
we did
didn't
great.
Even need the drill.
You're right. It says we did fine. Okay. Well, no.
So let's talk about what a good drill looks like, since I've got the experts here on what types of documentation we used to say, and I'll take talk about from a survey standpoint. It's always good to remind people. So a good drill is going to challenge you to find problems.
That's why you do it.
That's why you do it. Do not go in
to fill the mandate. I mean, this is why you do it.
Yeah, and it's a requirement, but challenge people, to do it. I still remember. It doesn't happen anymore because I don't allow it anymore. But we had a center who I happened to be there during the drill, and they said fire drill, and everybody left. And then out in the parking lot, the nurse manager was handing a clipboard around to sign off on it. And I'm sitting out there, I'm watching this whole thing and said, where's the discussion? What happened? What was the scenario? Oh, no, we just called off fire drill and everybody left the building. Well, first of all, by the way, leaving the building is not generally what you want to do during a fire drill if it happens while a procedure's going on. What are you going to do? Just leave the patient there. Yeah, that's right.
The oxygen is running. It shouldn't be a problem.
What could go wrong?
We're going to be right back.
Yeah, and taking it seriously because, I've seen some of the write-ups and they'll say, people were just walking out slowly and they're talking and you really have to stress to them, we want to find what problems might come up in a real situation, and can we really get out of here quickly, because you don't want to be learning it then.
And the way Alex has these set up is that you sit with your staff and go over the policy. Right. The way you have it written right now in your policy manual, this is what our policy says, and you do that before you ever pull the drill. Yeah. Then you do the drill and come back and say, okay, so did we follow this?
Did we do it?
Yeah. Should the policy be changed? Which could be it too. It's not that we screwed up. Right. We found a place where we need to review this policy. Otherwise, it's really just checking the weather outside. You're not really doing anything.
And Alex made sure of that as well. Each of those 3 drills that were done, had that policy and tie-in that I think is really important.
Yeah, he's made that a service that we're really good at now.
Yeah. I just have to tell this funny story. So we were on vacation. Remember, we were on vacation in, where were we? In Virginia Beach.
Yeah.
And we were in a hotel, pretty busy hotel. And the fire alarms go off. Sue and I do what we do. We get on the elevator. Well, I don't think we got on the elevator. I think we went down the stairs. We went downstairs, and we're outside, and we're alone.
All by yourself.
And
we're the only people that did it. The fire trucks are coming up. It was a fire.
Didn't walk over and say anything.
It couldn't have been a drill, right? There had to have been a fire.
It was a real fire. Yeah. We did find out later it was a small fire, but it was a fire in one of the floors. But we were the only people that responded.
And we got up to them and they're like, are you, and we said something to the staff later, the desk staff,
they weren't even with us.
Shouldn't you have told us where to go or to stand? Or is anybody aware?
Has our society become so desensitized to this?
I don't know. I felt like I was going to have to help the fire trucks get to wherever the fire was. I didn't even see anybody.
One out there.
We were the only one.
Somebody had to direct.
That's right. I was ready to take charge. I don't know anything about a hotel.
Does this happen every day?
But that's the whole point, is you got to take it seriously because you want to be prepared the day that it really happens. And it's going to happen. Something's going to happen. Somebody's going to cook popcorn and leave it in there too long. Or God forbid.
Toast and popcorn. Yeah. Those are the things. Toast and popcorn.
That's right. Get rid of that toaster.
Just write a policy. I'm sorry, no toast.
And nor popcorn. But take it seriously. Challenge your staff. Don't do the same fire drill. Don't do it in the operating room every time. Don't do it in post-op. Don't do it at noon
every day.
That's right.
It's got to be they actually look for, okay, we did it here at 7 before patients were here. We did it here at 5 when patients had gone home.
Yeah.
Great. You got to have one that was at noon, that was at 11. That they're going to look for that.
Yeah, and if different staff try
but you don't need
different shifts or things.
Judy, you don't need doctors to participate in this, right?
They're too busy. I don't know. They're too busy. They'll make a phone call.
Yeah. So we've actually seen in some of the surveyors who have actually cited centers for not having doctors. You can't get all the doctors to participate because it would be a nightmare trying to do that. But at least if the doctor is there, document that he was there also. And walk him through what he has to do during it. And that's the important part of that education, is walk everybody through what you would do during a fire drill.
That's another thing Alex said. You should involve these doctors in any of them, not just a fire drill. I mean, there's ones where we actually need them, like a Code Blue. We need them to be there. Incapacitated provider, which is always a fun one to do. Yeah. Got to have the provider in there. Or,
who's going to be incapacitated?
But even the ones that you don't think of naturally as clinical, a flood, loss of fire alarm, involve them, because if it really were to happen, chances are they're going to be there too.
You're right.
We'd rather they didn't burn to death. Usually under normal circumstances, probably not let them to burn to death.
Well, this has been a great talk. I really appreciate your time here. We covered a lot of topics. Just for those of you that are avid listeners, we're not doing the normal format here where we got a part 2. We're just going to record this, send this off, and kind of do this, and then we are going to we're going to report a couple interviews here, Sue, while we're here trying to get some insight from people. And so stay tuned, because there's going to be a Texas Association meeting coming up, an Ohio Association, special podcast coming up, New York. We're heading off to New York from here. Yeah, that's right. And if you are...
We don't have enough microphones for that. No. Do we?
That's what that big microphone over there is.
Oh, yeah, we got it right in the middle of the table.
But thanks so much for joining us. It's been great just to sit around and have more. Sue and I do so many of these things alone.
Can I say that it was nice to just be the grown-ups?
I think what...
No, you can't.
Because they probably don't listen to the podcast.
Yeah, they're probably not listening.
They never heard any of it.
What Judie's referring to is that, shall we say, we're some of the more senior individuals, experienced. What's the proper term?
Experience.
Old is the word. That's what
not the one I wanted to use.
Yeah, and a lot of our employees are younger.
Yeah, and the enthusiasm has been fantastic, and I guess that's one way to end this, is that as we're running into these challenges of staffing, and it's not just because of the pandemic, it's not just because of people, refusing to get vaccinated. We are running into significant problems where people are retiring. We know that a lot of the nursing staff that are on our, are getting up there in years, and have decided, maybe it's time for me to kind of move on. And you got to respect that. But that's why our nursing boot camps, our administrative boot camps, are so popular right now, is because we're seeing a lot of turnover. We're running a booth here, and we're handing out these flyers for the nursing manager boot camp, and that's like flying off the table. But I think the challenges that we have right now in trying to keep that staffing up and finding ways, to your point about our younger people, of course we love them, and they are the enthusiastic people. I mean, not that we're not enthusiastic. We're obviously passionate about what we do, but that youthful and energy.
Yeah, that's the word, John.
Energy.
That's that one thing that we don't even know what it's called.
Are a little lacking.
You made a good point. There was a nurse manager that came up to the booth just this morning, and I apologize, I don't remember where she was from. And you not only did you tell her, this is great, it's 4 days, you actually went on to say, if there's someone in your center you'd like to see advance, that you'd like to mentor, that you don't have to be a nurse manager. You can be, an heir apparent. You can be someone that's working that way. And I thought that's such a great idea, because succession planning is not something people do. What to do when something bad happens or somebody retires. Let's just say somebody retires.
Or wins the lottery. That's even more.
Yeah, I like that much better. Yeah. Think of those people that you want to bring up a little bit. This would be perfect for that.
We always start the nursing director conference or administrators conferences. How many of you, spent 3 years training to become, the nurse manager, went through all this mentoring with everybody, and of course, maybe one person will speak, usually not during the nursing directors conference. How many of you found out yesterday that you're the nurse manager?
How many people had a weekend? We're told on a Friday, and on Monday you're it. So you had the weekend to think about it.
So to that point, I think that things like this boot camp, things just in general about getting people involved, you're all stressed out. I'm talking to people that are probably listening to us on the train or in their car, on their way back and forth. It's doubtful that you're actually taking time out of your day to listen to this podcast. So start thinking about people that are very interested, that are young too. Sue, you and I, we've got a couple clients there that we've got some nurses that have just kind of popped in. I've said, I'm kind of interested in this whole thing. And, and hopefully the nursing director doesn't feel threatened at all about this. They find that as an opportunity. Maybe they can become your infection control managers. Maybe they can do your chart audits. Maybe they can even, I've suggested one of our centers to split the job of the infection control coordinator among a couple different people. There's no reason why, you kind of have to have one infection control coordinator, but it doesn't mean that infection control coordinator does all of the infection control work. Same thing with, oversight of your quality improvement program. Think about maybe you as a nursing director should have a quality control nurse, or even educational programs. We did that, in the last center that I had before I did this full time. We had one of our nurses whose job, in addition to, staffing the room, was in charge of all the educational programs. She didn't put them all on, but she was the one that coordinated with, companies or even staff inside, that had knowledge about it as to who was going to be doing those educational programs.
John, that's really important that you challenge your staff, especially those that are interested, to prepare them for the next stage. Critical.
I think I've said this already. That's how I want to end, because we're already 47 minutes.
Imagine that.
I've always felt very strongly that I encourage employees to tell me, okay, maybe I'm not going to stay with you forever. Maybe we have one of your centers, Judie. There's, an up and coming nurse manager who. She's going to do she's doing a great job at the center, but she's meant for bigger things. I mean, she's kind of told us she's meant for bigger things. That's okay. Be upfront about it. Give them the knowledge. While you've got them, enjoy the time that you have with them. You're probably going to get great things out of them, but be honest, take advantage of, what you get from that time, but also recognize some of them are going to move on, but use them and get them to help train the next generation. Constantly have this feeder out there for it. And as a nurse manager, as an administrator out there, don't feel like you have to do everything alone unless you really do. Don't have any choice. So think about that. Well, again, it has been a pleasure having you here. It's been great sitting around a table instead of in a closed-up studio here, and we'll talk again soon, maybe in New York in a couple days. Okay.
Thanks, John.
Thanks, John.
Thank you for being a loyal listener of the ASC Podcast with John Goehle. But did you know that you can enhance your experience and support the free podcast by becoming a patron member? Patron members have access to ASC Central and add-on service at a very reasonable price. Patron members have access to our regular drop-in virtual meetings where you can discuss issues that you are dealing with in your ambulatory surgery center with the hosts and other members. Members also have access to valuable member resources, including a document library with a growing list of resources, including the rules and regulations, guides to maintaining compliance, example policies and procedures, infection control resources, example risk assessments, example committee and governing body minutes, and over 60 disaster drill scenario kits and example forms and checklists. Members also have access to some of the virtual conferences that we have presented, including the Provider Credentialing Conference, which we offered in December 2020. It's a New World Conference in 2020. Infection Control in-Service to meet the challenges of COVID-19, and the ASC Mandatory Education Program, which is a valuable resource for annual education for your staff. Membership helps to defray the costs of producing the podcast, including the research staff, travel costs to conferences, equipment costs, and production costs. For more information, you may visit ascpodcast.com. To become a member, visit ascpodcast.com.
We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, and Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast has been an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.